more, we can speak to our international affairs commentator, Douglas Herbert. Hello to you. Doug, this is Blinken's fourth trip to the region, his last one a little over a month ago, but the stakes seem to be even higher this time around.
Yeah, another week, another mission. Critics of the U.S. policy towards Israel might be forgiven for wondering, will this mission make a difference? Because until now, a lot of the U.S. advice and the forceful persuasion of its close ally Israel has, in the views of much of the international community, fallen on deaf ears. Essentially, the Israeli military, from a lot of the outsiders' perspective, has just been on autopilot in its military drive, determined to, as it sees it, crush Hamas, eliminate it, whatever the price. Look, the remit officially for Antony Blinken, as he kicks off what is an 8-country, 9-stop tour, is, quote, to stem violence, to calm rhetoric, and to reduce regional tensions. That's quite a tall job order if you're going on a business trip. But look, it does come in a sharper, more escalated context, because it comes just days after, as you know, Hamas's number 2 leader was basically assassinated, wiped out in a drone strike attributed to Israel in Hezbollah's stronghold. Right in southern Beirut. It also comes just days after twin explosions in Iran, which, yes, were subsequently claimed by the Islamic State group, not Israel or the U.S., as some hinted might have been responsible. But nonetheless, that being another chaotic wild card in an already extremely volatile equation. And of course, you have the Red Sea attacks by the Houthi rebels on commercial shipping, leading many ships to reroute around Africa. And then perhaps the greatest threat of all, and the one that is front and center right now on Blinken's to-do list, is to try to prevent a spillover over the Lebanon border. We've had these tit-for-tat skirmishes between Israel and Lebanon with Hezbollah firing missiles at Israel retaliating over the past month. It's becoming more and more dire. Entire communities, both north of Israel's border and in Israel itself, south of the Lebanese border, have basically evacuated their towns because it's simply not safe for them to be there. And if that were to escalate, that would really trigger those, quote, fears of a broader regional conflict.
Yeah, and this potential widening conflict, very alarming. But also there's an urgent concern about getting more aid into Gaza concerning the humanitarian situation.
Once again, there's the perhaps inclination of a lot of people to start to roll their eyes. We keep droning on about humanitarian aid and how dire it is, the public health disaster, the crisis. It really, though, is becoming more dire, even beyond dire, to the extent that right now you've had, 2.3 million Palestinians pre-war, estimated population of Gaza. 85% of them will have been displaced. Now, of those, they're all being pushed further south to areas that the Palestinians going there say are not safe, despite the Israeli claims that these are the safer places for them to go as they evacuate from the military zones. There are entire families, according to the UN and the World Food Program, in southern Gaza, notably in Rafah, which is the southernmost town there, which go entire days without eating anything. As they become more displaced and more concentrated in a limited area, they say Rafah is now as densely populated as New York City, perhaps even more so. As they become more concentrated, you have disease outbreaks. This is what the WFP, the World Food Program, warns about. You had about 400,000 cases of disease outbreak since October 7th, the day of the Hamas attacks on Israel. 400,000. Of those, nearly 200,000 reported upper respiratory infections. You know, this is the type of thing when you have COVID, right? You have trouble breathing. Upper respiratory infections, very hard to cure. And lots of cases, especially among children in the group about 5 years old or younger, of getting diarrhea, which could lead to very terminal and deadly, potentially fatal dehydration. Extremely grave. This is part of, yes, the diplomatic remit of Antony Blinken, because he needs to, while limiting civilian casualties, while trying to prevent a spillover to the war, these big, broad geopolitical issues, the humanitarian issues are just as much dire and front and center, and he still has it on his to-do plate to get needed aid into Gaza, aid which is still far, far, far short of what is needed.
All right. Thank you very much, Douglas Herbert, our international affairs commentator.